Meantime, the questions about preparedness are everywhere, including right here in Oregon.
KEZI 9 News reporter Na Nguyen joins us live from one Eugene Urgent Care Clinic to show us how staff are getting ready just in case. Na?
Renee and Matt, with flu season upon us, staff here at the Eugene Urgent Care Clinic say they're always prepared for any type of infectious disease. But with a false Ebola case just last week, things really kicked into gear. And they say they've been working overtime to make sure they have a plan of action down for the other virus on everyone's mind. The potential is there.
Last week, we got a phone call. There's a patient that came off a plane in Portland who came to Eugene with a fever, and he came from Africa.
And the fear is real.
We expect him to show up at an emergency room. Get ready. We were all scrambling to be ready.
Thankfully, in this case.
Found out it was a false alarm.
And it served as a good practice run on response.
I've been purchasing items all week. We have so many different kind of systems. We've changed a lot of our systems. From the front door through, we are a much cleaner world. Thank you, this gentleman from last week.
Prepared for flu season, they knew things would have to be a little different. They've made an Ebola response binder with protocol that's constantly updated. And all employees review it when on shift. Managers are also in the process of creating kits for each location to include masks, booties, gowns, and hazmat suits are on the way. As patients come in, they immediately go through a checklist, cross-checking travel history and symptoms. If there's a chance they have Ebola, they'll know what to do.
Our plan was to immediately seal the clinic, close the clinic, call 911 like we would with anything, and have the hospitals prepare for the patient.
All 3 area hospitals have infectious disease containment capability. So while there is much uncertainty surrounding this virus, local healthcare professionals hope the public will find comfort knowing they'll be as prepared as possible.
I think in general, the environments in the emergency rooms and the urgent cares are responding. If that gives you a sense of some ease, I hope it does.
Staff members here say that while we're all concerned about Ebola, that we shouldn't let those fears cause us to overreact. And they say they're consciously working to buffer that fear by making sure that they at least have a clear and thorough plan of action in place. Live in Eugene, Na Nguyen, KEZI 9 News.